Alzheimer's disease is quite a common condition. It is the most common reason for dementia in elderly patients. And dementia, as we know, is a condition where there is a degeneration of the brain that occurs gradually, leading to decline in various functions of the brain. Now, whether or not it's hereditary is a very important uh, question for us to an answer for us to know. But in most of the cases, it is not hereditary. However, in a small percentage of patients, it may be hereditary. There may be a family history. There is a family history, and there are certain genes involved which may lead to a higher risk of getting the disease. Mainly when patients have uh, multiple members of a family get this disease, get Alzheimer's over generations, and especially when it begins at an earlier onset, that's when we suspect that it may be genetic in nature, it may be hereditary in nature. And that's when it's a good idea to get genetic counseling done to know about our risk for getting it. If we talk about the stages of Alzheimer's disease, it is a degenerative condition that is a long drawn process. It gradually progresses over several years. And if we look at it, there we can divide it up into three stages, like early, middle stage, and late stage. So in early stage, generally the most common symptom that the patient has is memory lapse. They will tend to have minor memory lapses. There will be problems in remembering certain conversations, events. They will have difficulty in remembering names of family and friends, things like that. They may develop some mood disorders, like they may have anxiety, they may have agitation. These are all early symptoms. In early stage, they will be able to go about their normal life as usual. In the middle stage, what happens is they tend to develop more severe memory problems. They will have difficulty in orienting themselves geographically, like they may have wandering episodes. They may get lost in known areas. They may have, if they're driving, they may have difficulty in locating roads. They may have difficulty in making judgments. They may develop some sort of obsessive, rigid behavioral patterns. And this is the time when they may need help in going about their daily activities from their friends or families. So that's the middle stage. Then going on to the later stage, that's when multiple domains of the brain get affected. Memory problem is severe. They may also develop speech and language issues. They may have difficulty in they may have incontinence, that is, they will have difficulty in controlling their bowel and bladder functions. They may have delusions, they may have behavioral issues. So at this point of time, they will need help for every activity of daily living. They will need help for mobility, they will need help for washing, bathing, feeding, all of this. So these are basically the stages of Alzheimer's disease. In the most common type of Alzheimer's disease, the way we know it in general, the most common early symptom is memory lapse. There'll be minor memory problems, like they will have difficulty in remembering conversation. They may forget to pass on informations. They may not remember names of their friends, things like that. These are the earliest symptoms of Alzheimer's disease. If we talk about biologically, well, what we have found so far is that Alzheimer's disease is caused because of deposition of some abnormal proteins in and around brain cells inside our brain. These are proteins which are known as amyloid protein. They form plaques, and there are certain other proteins called tau proteins. And gradually, as this process progresses, there will be shrinkage of certain brain areas, which will cause the symptoms of the disease. If I, as a person, want to know what is causing my Alzheimer's disease, apart from this biological issue, well, there are certain factors which are considered as risk factors. Like the first thing is age. Alzheimer's is most commonly a disease of the elderly. As we grow older, our risk for getting dementia also increases. Like after 65 years of age, for every 5 years, the risk increases. With every 5 years, the risk of getting dementia increases. Apart from this, there are certain risk factors for cardiovascular diseases, which are also known to increase the risk of Alzheimer's disease, like having high blood sugar, having diabetes, high blood pressure, high cholesterol, obesity, smoking, excessive alcohol intake. These are the risk factors which may increase our risk for having acquiring the disease. It is the person suffering from it who will pick it up the first. The person, as well as his or her family members, his or her close associates, who will pick up the signs and symptoms initially. So once somebody feels that they're having recurrent memory issues does not directly mean dementia. Many of us at various stages of our life will have memory issues. We have it in our daily lives. But that does not mean that we are going towards Alzheimer's disease because memory issues can be there for multiple reasons. So, but when an elderly patient, especially an elderly patient, notices that recurrent problems with memory, they pick it up, the family picks it up. The first thing they need to do is go to a doctor. So, what the doctor, that in this case, I will be talking about a neurologist. What a neurologist does is, first of all, we need to find out the history of the person, like what exactly are the problems, what are the lapses that he or she is having. Secondly, what we do is we do something called a cognitive assessment, which is basically a series of mental tests of mental abilities, which are mostly pen and paper tests, and some are like verbal questioning and answering. So, based on these, we have a set pattern of questionnaires, set pattern of tests and assessments via which we find out what are the domains of the brain which are not functioning at par with his or her age. Based on this, we diagnose a dementia clinically, and then additionally to confirm our diagnosis, we do certain tests like we do some blood tests, and then we do brain scanning, which is most commonly what we do is an MRI brain. So this is how we come to a diagnosis of Alzheimer's disease. There is no medication that is going to arrest the process, or there's no medication that is going to prevent the process. So, as such, there is no cure, but there are medications available which we use to reduce the symptoms to some extent. Uh, there are medications to take care of individual symptoms, with which our goal remains to make the person as comfortable as possible, as to improve quality of life as much as possible. This is via medications. Another important role, apart from medications, is in cognitive rehab, which is equally important as medications. In rehab, what we do is we tend to utilize that part of the brain which is functioning well to make use for the parts which are not functioning well. And by this, we mean we tend to give the person certain tasks to do at home, certain jobs that he or she can do easily with a bit of help from his or her caregiver. And the family is very much involved in this mode of treatment of the patient. So these are the two modalities of treating an Alzheimer's patient: medications and non pharmacological treatment, that is rehabilitation. It is a very challenging matter for the caregiver. So there are many aspects of it. First of all, they should have a constant regime to be followed at home, because Alzheimer's disease, they tend to get disoriented in unfamiliar settings with unfamiliar people and places. So they need to have a constant regime, like the time of eating, time of bathing, time of dressing. Like they should have a constant regime with which they can get themselves oriented to avoid confusion, to avoid forgetfulness. So, first of all, a constant regime. We should avoid making unplanned changes to their regime frequently, because then they may tend to get anxious, agitated, further confused. So, that will not help them. So, apart from that, we should have fixed timings for different activities. As a caregiver, we need to be very calm and we need to be patient with them. We need to have simple conversations with them. We need to communicate with them. We need to make eye contact with them when we talk to them. We need to smile. Normal modes of communication. We should not treat them as somebody who's invalid. Just go to them when they need feeding and then just go about our own activities. We have to give time to them. When talking to them, we need to, if you're asking them something, we need to ask them one question at a time, so as to not confuse them. So that is one way. We need to have some, it's it's we need to avoid social isolation and loneliness, because that is one thing which is very important in our current social scenario. Elderly people, they're generally alone. And people who are suffering from dementia, if they don't get to see people around them, if they don't have communication, then they tend to deteriorate faster. So we need to avoid social isolation and loneliness for these people. And we need to have some planned activities, whatever they are comfortable with, like some gardening, some yoga, some board games, some simple games like Ludo and all. If they like cooking, they can help, like they can just sit and do something. Reading out a book to them, reading out some of their favorite stories, watching a movie with them. These are activities which will indulge their brain functions and also make them feel cared for and safe and secure. So these are the things which we need to do for a patient of Alzheimer's who's not entirely bedridden, who's not entirely lost his faculties yet. So these are the things which will help them maintain a good quality of life. And lastly, but very importantly, as a caregiver, we need to take care of ourselves. Like the person who's taking care of the Alzheimer's patient, that person needs to be well cared for, because taking care of an Alzheimer's patient is can be very exhausting. So that person's mental and physical health needs to be ensured. Food habits need to be very good. Like they need to maintain a balanced and healthy diet for Alzheimer's patients. So this is how we take care of an Alzheimer's patient at home. Unfortunately, since there are no known strong causes that cause this disease, there is no strong preventable methods also for this preventive strategies also for this disease. But however, there are certain things which may help us reduce the risk of getting the disease, like maintaining a healthy lifestyle, bringing down the risk factors for cardiovascular diseases. Because as I mentioned, the risk factors for cardiovascular diseases also increase the risk for Alzheimer's. So we need to bring down those risk factors, like stop smoking, cut down on alcohol to the minimum permissible limit, control obesity, control blood pressure, control blood sugar, control high cholesterol, maintain an active lifestyle, avoid sedentary lifestyle, avoid sitting for too long. And by exercise, I mean at least, like the best thing recommended is at least 150 minutes of exercise in a week. Moderate intensity level exercises like cycling, brisk walking, things like that. So maintaining a healthy lifestyle is very important. Apart from that, maintaining our cognitive functions, being mentally active is very important, like reading, writing, engaging in conversation, maintaining a healthy social life, having friends, having families to talk to visit. Um, these are all very important methods by which we can bring down our risk. Actually, this is all we can do to bring down our risk for getting Alzheimer's disease.